Welcome to Organic Health Hub, your trusted source for all things related to natural health and well-being. Today, we are exploring the fascinating world of sleep. Do you know what happens to your body and mind when you close your eyes and drift off to dreamland? You might think that sleep is a passive and boring state, but in fact, it is a dynamic and active process. In this video, we will share with you 20 things that happen while we sleep, some of which might surprise you. You will also discover some of the strange and rare phenomena that can occur during sleep, such as sleep paralysis, exploding head syndrome, or sexsomnia. So stay tuned and get ready to be amazed by the wonders of sleep. And before we start, please make sure to subscribe to our channel and hit the bell icon to get notified of our future videos. So let's get started. Have you ever felt like you were falling in your sleep and suddenly woke up with a jolt? That's called a hypnic jerk, and it happens to about 70% of people. Scientists are not sure why it happens, but some possible causes are stress, caffeine, or irregular sleep patterns. Hypnic jerks can be annoying, but they are not harmful. They are just your body's way of saying, "Hey, wake up, you're falling." Sleep talking, or somniloquy, is a common phenomenon that can range from mumbling to full sentences. It usually occurs during the transition between different stages of sleep, and it is not related to your dreams. Sleep talking can be triggered by stress, fever, alcohol, or medications. Sleep talking can be funny, embarrassing, or even revealing depending on what you say. You might confess your secrets, insult your partner, or speak in a different language. Bruxism is the medical term for grinding your teeth or clenching your jaw during sleep. It can cause tooth damage, headaches, and jaw pain. Bruxism can be caused by stress, anxiety, sleep apnea, or misaligned teeth. A dentist can diagnose bruxism and recommend treatments such as mouth guards, relaxation techniques, or Botox injections. Bruxism can be annoying, painful, or even costly depending on the severity of your condition. Snoring is the sound of your airway being partially obstructed by your tongue, soft palate, or throat tissues. It can affect your quality of sleep and your partner's. Snoring can be caused by obesity, alcohol, smoking, allergies, or nasal congestion. Some remedies for snoring include sleeping on your side, elevating your head, or using nasal strips or sprays. Snoring can be loud, annoying, or even dangerous depending on the cause and the volume. You might disturb your partner, your neighbors, or even yourself. Sleep apnea is a serious condition where your breathing stops and starts repeatedly during sleep. It can cause loud snoring, gasping, choking, or snorting sounds. Sleep apnea can increase your risk of high blood pressure, heart disease, stroke, and diabetes. It can be treated with a CPAP machine, surgery, or oral appliances. Sleep apnea can be scary, life-threatening, or even fatal depending on the frequency and the duration of your episodes. You might need to see a doctor, wear a mask, or undergo a procedure. Nightmares are unpleasant or frightening dreams that can cause you to wake up, feeling scared, anxious, or sad. Nightmares usually occur during the REM stage of sleep when your brain is most active. Nightmares can be triggered by stress, trauma, medication, or illness. To cope with nightmares, you can try to relax before bed, write down your dreams, or talk to someone about them. Nightmares can be disturbing, upsetting, or even traumatic, depending on the content and the intensity of your dreams. You might have trouble falling back asleep, feel depressed, or develop a phobia. Night terrors are episodes of intense fear and screaming that occur during the first half of the night, usually in children. Unlike nightmares, night terrors are not dreams and the person does not remember them in the morning. Night terrors can be caused by stress, fever, sleep deprivation, or genetic factors. To prevent night terrors, you can try to keep a regular sleep schedule. Avoid scary movies or games, or comfort your child if they have one. Night terrors can be terrifying, alarming, or even violent depending on the behavior and the reaction of the person. You might need to calm them down, restrain them, or call for help. Sleep paralysis is a state of being unable to move or speak while falling asleep or waking up. It can also be accompanied by hallucinations of seeing, hearing, or feeling things that are not there. Sleep paralysis can be very frightening, but it is not harmful. It can be caused by irregular sleep patterns, stress, or narcolepsy. To avoid sleep paralysis, you can try to sleep on your back, avoid alcohol or drugs, or practice good sleep hygiene. Sleep paralysis can be creepy, spooky, or even demonic, depending on the hallucinations and the sensations. You might see a shadow, hear a voice, or feel a pressure. Lucid dreams are dreams where you are aware that you are dreaming and can control some aspects of the dream. Lucid dreaming can be fun, creative, or therapeutic depending on how you use it. Lucid dreaming can be induced by various techniques, such as reality checks, mnemonic induction, or wake back to bed method. Lucid dreaming can be exciting, adventurous, or even enlightening depending on the scenarios and the outcomes. You might fly, fight, or explore. Exploding head syndrome is a rare condition where you hear a loud noise, such as a gunshot, a bomb, or a crash, right before falling asleep or waking up. It can also cause flashes of light, pain, or sweating. Exploding head syndrome can be very startling, but it is not dangerous. It can be caused by stress, fatigue, or sleep disorders. To reduce the occurrence of exploding head syndrome, you can try to relax, meditate, or listen to soothing sounds before bed. Exploding head syndrome can be shocking, surprising, or even amusing depending on the noise and the reaction. You might think someone is breaking in, a war is starting, or fireworks are going off. Sexsomnia is a type of parasomnia where you engage in sexual activities while asleep, such as masturbating, fondling, or having intercourse. You might not remember anything in the morning, but your partner might. Sexsomnia can be embarrassing, awkward, or even illegal depending on the situation. Sexsomnia can be triggered by alcohol, drugs, sleep deprivation, or stress. To prevent sexsomnia, you can try to sleep alone, lock your door, or seek professional help. Sexsomnia can be enjoyable, confusing, or even problematic depending on the consent and the consequences. You might have an orgasm, a pregnancy, or a lawsuit. Sleepwalking, or somnambulism, is a disorder where you perform complex actions while asleep, such as walking, eating, dressing, or driving. You might not remember anything in the morning, but you might find clues or witnesses. Sleepwalking can be dangerous, especially if you leave your house or harm yourself or others. Sleepwalking can be caused by genetic factors, sleep deprivation, medication, or alcohol. To stop sleepwalking, you can try to keep a regular sleep schedule, avoid stimulants, or use an alarm or motion sensor. Sleepwalking can be amusing, bizarre, or even horrifying depending on the activity and the outcome. You might find yourself in the kitchen, the bathroom, or the police station. REM sleep behavior disorder is a condition where you act out your dreams physically, such as kicking, punching, or shouting. You might injure yourself or your partner in the process. REM sleep behavior disorder can be a sign of neurological diseases, such as Parkinson's or Alzheimer's. It can be treated with medication, behavioral therapy, or safety measures. REM sleep behavior disorder can be funny, annoying, or even dangerous depending on the dream and the action. You might act like a superhero, a villain, or a victim. Nocturnal groaning, or cataphrenia, is a disorder where you make loud, prolonged, or high-pitched sounds while exhaling during sleep. It can sound like moaning, groaning, or squeaking. It can disturb your partner or your neighbors, but it does not affect your health. Nocturnal groaning can be related to stress, anxiety, or sleep apnea. It can be managed with CPAP therapy, surgery, or soundproofing. Nocturnal groaning can be annoying, embarrassing, or even arousing depending on the sound and the interpretation. You might sound like a ghost, a baby, or a lover. Sleeping can help you burn calories, especially during the REM stage when your brain is more active. Sleeping can also regulate your appetite hormones, such as leptin and ghrelin, and prevent you from overeating. Sleeping can also boost your metabolism, muscle growth, and immune system, which can help you lose weight. To optimize your weight loss, you can try to sleep for 7 to 9 hours per night. Avoid eating or drinking before bed, or exercise regularly. Sleeping can stimulate the production of human growth hormone, or HGH, which is responsible for your height, muscle mass, and bone density. HGH is released in pulses during the night, especially during the deep sleep stage. Sleeping can also decompress your spine, which can make you slightly taller in the morning. To maximize your growth, you can try to sleep for 8 to 10 hours per night. Avoid caffeine or alcohol, or stretch your body before bed. Sleeping can help your body repair itself from injuries, infections, or diseases. Sleeping can increase your blood flow, oxygen, and nutrients to your tissues, which can speed up the healing process. Sleeping can also reduce inflammation, pain, and stress, which can improve your recovery. To enhance your healing, you can try to sleep for 9 to 11 hours per night, elevate your wound, or apply ice or heat. Sleeping can enhance your memory, concentration, and creativity, which can help you learn new things. Sleeping can consolidate your short-term memory into long-term memory, which can prevent you from forgetting. Sleeping can also clear your mind, sharpen your focus, and boost your problem-solving skills, which can help you perform better. To improve your learning, you can try to sleep for 7 to 9 hours per night, review your notes before bed, or take a nap after studying. Learning better can be useful, enjoyable, or even impressive depending on the subject and the level of difficulty. You might ace a test, master a skill, or discover something new. Sleeping can flush out the toxins and waste products that accumulate in your brain during the day. Sleeping can activate the glymphatic system, which is a network of channels that drain the cerebrospinal fluid from your brain. Sleeping can also remove the beta-amyloid protein, which is linked to Alzheimer's disease. To cleanse your brain, you can try to sleep for 7 to 9 hours per night, sleep on your side, or drink enough water. Detoxifying your brain can be refreshing, cleansing, or even preventive depending on the amount and the type of toxins. You might feel more alert, more energetic, or more protected. Dreaming is one of the most mysterious and fascinating things that happen while we sleep. Dreaming can occur in any stage of sleep, but it is most vivid and memorable during the REM stage. Dreaming can reflect your emotions, thoughts, or experiences, or it can be completely random and bizarre. Dreaming can also help you process your information, cope with your trauma, or express your creativity. Dreaming can be fun, insightful, or even life-changing depending on the meaning and the impact of your dreams. You might laugh, cry, or learn. So these are 20 things that happen while we sleep. We hope you enjoyed this video and learned something new. Let us know in the comments what are some of the things that happen to you while you sleep. Thank you for joining us. If you found this video valuable, please support us by liking, sharing, and subscribing to Organic Health Hub. Feel free to share your questions, experiences, or topics you'd like us to explore in future videos in the comments section below. Explore these other videos from our channel too.